Absolutely. Yeah, non-smoking, Atlanta, no, those are the correct dates, that's right. And then back for Sacramento, yes, correct. Oh, I gotta go. Thank you. Hello, and welcome to The Public's Health, the show that puts the public, that's you, back in the public's health. I'm Dr. Tony Iton, the Alameda County Health Officer, and today we've got an exciting show for you. First, you heard me on the phone making travel arrangements. It's hard enough sometimes to make arrangements for things that you expect. But now, to prepare for the unexpected, that's even more difficult. And particularly if you have issues related to disability, or you're very old, or you're very poor, or you live in a community that doesn't have a lot of resources. Today we're going to showcase a unique collaborative effort between the Alameda County Public Health Department and the City of Fremont. Now the goal of this effort is to pursue the belief that we are not prepared until our most vulnerable citizens in our communities are prepared. And that's one of the lessons learned from Hurricane Katrina. This effort is designed to work in partnership with the City of Fremont and community-based agencies in Fremont to find and assess the state of preparedness of our most vulnerable residents in our low-income communities. So what you're going to see is an overview of a survey that was done in Fremont several months ago, and you're going to hear about the process that these collaborative partners put together to try to better prepare the most vulnerable residents of this Fremont neighborhood for a disaster.
Last September, Alameda County's emergency preparedness plans accelerated following Hurricane Katrina. A project was proposed designed to increase preparedness among vulnerable groups like seniors, the poor, and people living with disabilities. We realized the Irvington neighborhood in Fremont had this kind of vulnerable population. This led to the creation of the Irvington Neighborhood Emergency Preparedness Project. We decided to launch the project with a preparedness survey.
On April 8, 2006, we gathered over 60 volunteers at the Sequoia Manor apartment complex for the survey. Our community partners included the City of Fremont's Fire Department, the Fremont Family Resource Center, the Irvington Neighborhood Network, and many other community-based organizations. Half of the volunteers who participated actually live in Fremont. We were especially pleased to have high school students participate. We also had a wealth of bilingual volunteers. We'll come back to that in a minute.
Health Officer Dr. Tony Iton spoke to the group, as did Vic Valdes of the Fremont Fire Department. Apartment complex managers were also on hand.
Sandra Witt briefed everyone on their responsibilities. The volunteers formed small groups and prepared to go door to door for the survey. They encouraged residents to take the survey by giving them a big red backpack filled with emergency supplies.
In our diverse community, finding a sufficient number of bilingual speakers is sometimes a problem. Not so on the Irvington survey. Our volunteers conducted interviews in Spanish, in 2 Chinese languages, which were Mandarin and Cantonese, in Russian, and in Punjabi.
Besides the backpack, every household also received information about disaster preparedness and local social service programs.
How did we do? In terms of feedback from the residents, it was very positive. Several called and wrote notes thanking us for the backpacks and for taking the time to talk to them in their homes.
In terms of findings, we learned that a number of respondents had already taken steps to prepare their homes for an emergency, such as purchasing supplies and designating an out-of-state contact to call in case of an emergency. Some had been trained in first aid or disaster preparedness, and others were interested in training in the future.
We identified some key barriers to preparedness, such as the perceived cost of supplies or the lack of proper information. Future trainings and educational materials will be tailored to address these barriers.
We're confident this project demonstrates a model for community collaboration we can take to other parts of the county in the future.
And even as we look to the future, the community is better prepared now And so are we as the Alameda County Public Health Department.
I'm Tiffany Tasby. A recent survey questioned Oakland teens about their alcohol use. More than half of the respondents were 15 and 16-year-olds. Why do they drink? 59% reported drinking due to stress or depression. If you're a teen or you know one who struggles with stress or depression, help is available. Visit the Alameda County Public Health Department website at acphd.org and read Oakland on the Rocks. Let's work together to keep our youth safe.
Another thing that we're going to see, which also happened in the city of Fremont in partnership with Alameda County Public Health Department, is a mass dispensing drill. And that is a preparation for something that we hope never happens. But in essence, if there ever was an event where many, many people were exposed to a biological agent against which the only treatment would be antibiotics, and we needed to get antibiotics or a vaccine or some other medical measure into a large population in a very short period of time, we would do a mass dispensing effort. And that would be using churches, fire stations, schools, what have you, to get people the appropriate medications as quickly as possible. And what you're going to see is a drill of exactly that function.
This is the Rough and Ready drill. It's taking place in the city of Fremont. And this is part of, in conjunction with a state exercise, which is called Rough and Ready. The city of Fremont wanted to exercise their point of dispensing site, and the Public Health Department is exercising our plan to do mass dispensing.
So the scenario here is that we're responding to a anthrax attack that has occurred in the city of Fremont, and potentially the entire city of Fremont, which is a population of 210,000 people, have been exposed to anthrax.
A mass dispensing exercise is a role play of going through dispensing medicines emergently to a population in the event of a public health emergency or a public health threat.
So our response would be to set up mass dispensing sites such as we're simulating in this exercise, and providing medications to our citizens who are potentially exposed to anthrax before they become ill with the organism.
The goals of this drill were to build upon the exercise that we had done before, as well as to implement a few new things.
Our objective would be to provide prophylactic medication for our entire population of Alameda County within 48 hours. We're practicing setting this up, doing the just-in-time training for non-public health staff.
How we train staff that show up and that they didn't know anything about what was going on in terms of training them how to process people through.
And then actually we'll be opening it up to simulated victims to go through the process of filling out the medical forms.
We had also created a new form to go through clinical symptoms, signs and symptoms of anthrax, to see whether or not that worked in terms of screening people.
Being screened, evaluated.
We have some time studies. The forms are being marked at certain times and certain points during the process to see how fast we're processing people.
And then provided with the appropriate medications.
We also have a DMAT team, which has come from across the nation. A lot of them have come from California and in the Bay Area.
The purpose of this is not to treat people who are ill with from exposure to anthrax or other disease organisms, but to provide them with the medication prior to them becoming ill, to protect them from becoming ill.
We were also testing out scanning driver's license to see whether or not that process would be efficient in terms of getting people through and getting demographic information in. The more practice you do, the better you are figuring out the mistakes in terms of processes, things that come up that you wouldn't think of in terms of sitting at a table and planning. It's better to go through stuff and do real life.
What we are really exercising is the ability of Alameda County Public Health Department to work with cities such as ours to provide the facilities and additional staff to set up many, potentially up to 100 mass dispensing sites throughout the county.
We hope to do drills in every city that has identified a site, and we're working with every city to do that. There will be multiple sites in each city. Public Health Department is the lead in terms of planning for mass dispensing. The planning process requires a lot of collaboration and the people who would be involved in implementing a plan, which is the Public Health Department, the cities, the city emergency managers, fire departments, police, sheriff's department, public health nurses, as well as other clinical and medical personnel within the community.
The vast majority of our disaster victims are from our community emergency response team. The city of Oakland also, and as well as other cities, have also assisted us in putting the message out for volunteer actors.
I belong to the CERT team, which is the Fremont Fire Department for emergency team, and I try to come in and help or play a victim if possible.
I thought I was just going to help her stack up stuff, because usually I help her out, I help stack up, help her make the plan, because she be like sometimes having drills for firemen to practice, and I be like the victim, because like my leg's injured or something like that. Or help out with safety rules, like bike routes for little kids and stuff like that. I really don't know. I know you get rashy skin and stuff like that, and other stuff in your stomach areas and stuff. Basically, like the skin part, that's nasty. How you get it, that part, I don't know.
During our interview with them, they give us information sheets on how we might have contacted it and what we can do and how to deal with it. And if we have further symptoms, we should contact doctors.
I think compared to other communities and other locales, we're much better prepared. However, there's still additional work that needs to be done.
Well, we're always prepared, but we're always trying to improve on stuff. There's always something that we can work on.
It's really an ongoing endeavor to really continue to improve preparedness.
We know the things that we're supposed to do. Some of it is getting the people who are also involved in the process to come in and help us plan and play their role within that process. And we're working on a lot of that, as well as in improving the things that we're talking about doing.
This exercise will really build on additional planning and really enhance our preparedness to respond to potential catastrophic events.
And then we're going to change gears completely. Some 210 million women worldwide get pregnant every year. And for those of us who've had children, we all know how challenging and exciting pregnancy can be. And we know that the concern about the successful outcome of pregnancy is something that every woman has when they become pregnant. Well, imagine being pregnant and being challenged by addiction to substances. Well, we're going to talk a little bit about a very unique program that Alameda County Public Health Department has in concert with our partners in the community, doctors and others, in our perinatal substance abuse program. And the goal of this program is to train doctors and other providers to be able to identify perinatal substance abuse, and that it is pregnant women who are using substances, and appropriately detect them and refer them for treatment to optimize the kind of care and the conditions that a baby will be born into. So we hope that you enjoy this program and these disparate topics. And we certainly expect that you'll continue to give us feedback and input as to how we can serve you in our role as your servants in public health. Oh, there's my phone again. Yep. Arnold? How you doing? You got Anita and Muntu with you there? Okay, good.
Welcome back. We're going to switch gears a little bit here. And talk about perinatal substance abuse. My name is Lynn Chung, and I work with the Public Health Department with Dr. Iton in the Maternal, Child, and Adolescent Health Services. We have a couple of guests today, too. Dani Taylor, who is actually a colleague of mine at the Public Health Department. She's the director of the Improving Pregnancy Outcomes Program, and Dani will talk a little bit about that. And then we also have a very special guest today, Sanya Prince, who is a client of one of our programs in the county, Project Pride, and maybe Sanya can also tell us a little bit about that program too. Maybe we can start out a little bit with Dani saying, first of all, how it is her program is involved with the issue of perinatal substance abuse.
The Improving Pregnancy Outcomes program was started to try to look at the issue of infant mortality and poor birth outcomes. And when we started trying to analyze what the issues were, we saw problems around low birth weight, very low birth weight, prematurity, and SID, sudden infant death syndrome. When we try to analyze what was going on in reference to low birth weight and very low birth weight, because babies who are born too small and too early are at risk for higher infant deaths and illness problems, when we looked at that, we saw that there were some lifestyle issues that could potentially be addressed. And we started looking at the issue of substance abuse during pregnancy. And there are some drugs where if you take them, the mother is at risk for having a premature birth and a very low birth weight infant. And so we started saying, what can we do? How can we address this issue? How can we have fewer babies born low birth weight and premature? And so we said, okay, substance abuse is an issue that we cannot ignore.
Right. And maybe we should clarify to the audience too a little bit about what we mean by perinatal substance abuse. I mean, peri sort of means around the time, and so we're talking about around the time of pregnancy. So prenatally and then just after pregnancy too, when the baby's born. And we're talking not just about illicit or illegal drugs like cocaine, heroin, and marijuana, but we're talking about other drugs that are legal like alcohol, tobacco, or a couple of the big things.
Exactly. I think when we first started looking at this issue in 1992, there was a study that looked at the use of substances during pregnancy throughout the state. And in Alameda County, I think we had about 17% of the moms who were using substances during their pregnancy. I guess we were the second highest in the state. And when we looked at the substances used, we saw that about 2,200 babies were born whose mothers were cigarette smoking while they were pregnant. And we saw that about 1,200 moms, or 1,200 babies whose moms were using illicit drugs while they were pregnant. So we have, as you said, a gamut of legal substances versus illegal substances that women use during pregnancy. And I think our goal is to try to reduce the number of women using substances that could negatively affect their infants.
Right. Well, and I think so many of these issues and problems that are happening with our young children who are exposed are totally preventable. I mean, these are substances like tobacco and alcohol that are legal, but we can prevent those problems with the children from happening if we really can. And I think Sanya was using a number of these substances, both legal and illegal.
Yes.
Do you want to say a little bit about some of the substances that were sort of on your list of pattern?
Well, methamphetamine, crack cocaine, and heroin. Those were my favorite drugs. And I also smoked cigarettes, and I didn't drink alcohol, though.
And there are a lot of physical as well as not necessarily physical difficulties that the babies are born with. But there are also kinds of behavioral and developmental kinds of problems.
I think that's one of the things that are not so obvious sometimes with the substance use. I know that in our county there is a lot of marijuana use, and people think, oh, medicinal marijuana.
Right.
But there can be an effect long term on a child in reference to their ability, their what they call executive decision making. And so sometimes it can be a subtle kind of thing or not so subtle kind of thing that affects the behavior of a child. And so I think that that's not often talked about. I think when we look at the issues of behavior problems and learning problems further down the line as a child enters school.
So we know, like with fetal alcohol syndrome, there are a lot of facial features that are more obvious and noticeable, but as you say, there are other kinds of developmental and behavioral kinds of things that might not come up till maybe the child approaches school age that are not so obvious. They're much more subtle.
Exactly.
And that's a big public health issue because these kids who may have impulse problems and hyperactivity later on and aggressive behaviors, where might they end up?
Well, I think often people give them Ritalin. I mean, they're trying to calm them down, and there may not often be the proper analysis done to see what can be done besides giving them a drug. And I think that's an issue. I think that is becoming a greater public health issue because so many children are being given drugs to kind of quiet them down and make them behave in school so that things can happen.
Right.
But there may be some effects that are happening as a result of substance use during pregnancy that need to be addressed.
Right. I think probably a lot of the children who are being diagnosed as ADD or attention deficit disorder, attention hyperactivity disorder, may have been exposed perhaps during the prenatal period and are just sort of manifesting some of those things that they were exposed to in utero. So we're seeing a lot of that in the schools. And I know with medicating kids, if they're not necessarily in need of medication, they can often make things worse. So proper diagnosis and early detection is really important, I would imagine.
And early treatment.
Right. And speaking of treatment too, we have, I think there are a lot of physicians and providers out there in our county who are not familiar with the fact that we have a lot of different treatment programs available in our county. We have a good dozen programs that provide a variety of services, outpatient, day treatment, residential, and Sanya's with us from one of our residential programs. And do you want to say a little bit about where you're staying and how you came to be there?
Yes, I'm staying in a program called Project Pride. It's in Oakland. And I was in jail, and I got there from jail. And also I just had a baby, which was detox and methadone. So while waiting for my baby to come home to me, they let me go to a program. And that's where I stay now.
And you came directly from a correctional institution?
No, Santa Rita Jail.
Right, okay.
They gave me a choice to do jail time, or they gave me a choice to do a program, which I was pregnant at the time, so the judge kind of said it was all right if I do a program.
And so you actually came because someone told you, a judge said,
yeah,
you
it was
need to
mandatory. I had to do a year mandatory and program, which I have already done.
So tell us a little bit about what life was like when you were actively using.
Well, I was still pregnant at the time. I was doing a lot of drugs. I was out there prostituting at the time, just doing a lot of drugs. And it was just miserable. I just should have been, I just didn't feel like I was alive anymore because I was doing so much drugs.
And a lot of people might say, my goodness, how can she knowingly be pregnant and still be using the drugs? But do you want to say a little bit about the addictive process and how that kind of overrides certain priorities?
Well, when I was addicted to drugs, nothing else mattered. All I wanted was the drugs. So it just continued on from there, but now it's changed. I don't do drugs anymore. Still on methadone, but that's a different story.
And actually, you've been at Project Pride now for
almost 2 years.
Okay, and so your 1 year's mandatory time being there is over.
It's over.
So do you want to say a little bit about why you're still there?
Yeah, I still want to stay. I still want to stay on because it's helping me a lot. I've changed. We do a lot of things there. We go on a lot of trips, and we just do a lot of fun things, and it's really helped me a lot. It's helped me with my parenting skills. I never thought I could take care of a baby, but I'm doing a really good job. I have, she's almost 2 years old, daughter, and she's doing really good. We're both doing good. You know, we're finally living, we're living a good life.
Okay. Do you want to say a little bit maybe what a typical day might be like so that our viewers might have some idea?
I wake up in the morning, me and my daughter, I dress her, and then we go have breakfast together. Later on throughout the day, I take her to CE, which is child enrichment. And Then I go to my group. I go to therapy next door because I have some mental problems too that I deal with, along with my addiction problems too. And I go there to therapy, and then I come home, I pick her up, and then we go out and we play in the backyard. And then we go watch TV, and then we have dinner, and then I give her a bath, and then we call it a night.
So you're able to get services not just to address the addiction, but for mental health support and parenting kinds of things too.
Yes, yes, they have a lot of.
Okay, so are there any things that you would like in terms of what you would hope for, the both of you, as you may be leaving Project Pride at some point, what your hopes and dreams are for both you and your daughter?
My hopes and dreams are for me to continue being a good mother to my daughter, and to eventually get housing, which I'm working on now for me and my daughter, and to go on from there.
Well, I think you're off to a good start.
Yeah, so life's getting better every day.
Wonderful. And I think this is sort of a good example of how we're able to get all of our programs together to work together, correctional as well as our treatment. Are things, do you want to say something, Dani?
I think it's very important to work in reference to continuing to have treatment available.
Okay. Well, I appreciate both of our guests here today, and we'll be joining you again in the studio with Public Health. We appreciate your coming in and joining us today. Thanks very much, and we'll see you next time on the Public Health. Was I over? Oh, sorry.